today's webinar, and we are still counting more. I mean, people are joining yet. So as Mayank has very rightly said, I will be waiting back for questions. I will be taking questions in English, Hindi, Gujarati, Marathi, whatever language probably you need to ask. I should be able to answer those. I may not be able to speak any of the South languages, anything to do with Tamil, Tulu, Malayalam. That's not my language. I don't understand, neither I speak. But having said that, let's try understand why we and what is to feed successfully, right? I saw a lot of mothers joining from across India, and
And
that's
Swati
very
ma'am, we
nice to see.
also have a lot of mothers who are expecting today. We have a lot of expecting moms, so we can focus a
Oh,
little bit more.
lovely.
Yeah,
Okay,
we
that's
can focus
that's
a little
really
bit
nice to
more
know.
on the golden hour part.
Okay, wonderful. So I'm so glad because always I have felt that the mothers who are in trimester 3 should know about what lactation and how to lactate successfully. The mothers who have already delivered probably may be facing some challenge wherein they join our sessions and webinars and they become a part of our programs to seek help. But the ones who are getting into that phase, if they know well, probably they don't land up into trouble. So welcome all the mothers today on the webinar,
Hey
and
guys,
let's
do you
get
see this
going.
presentation on the
Right.
screen?
So at
This
Baby Nama,
exact
we
presentation.
have a team of certified and qualified lactation experts, including myself. We have Dr. Sumitra, we have Dr. Ghazal, we have Dr. Darshana, Vinodini, we have Dr. Anuradha and Dr. Pooja. So all of us basically have been here and have been handling a lot many lactation issues with a lot of women who join our programs. So please feel free to be a part of Baby Nama, and I'm sure most of your queries we should be able to handle as soon as is possible, right? A little about myself. I am a maternal and a child health nutritionist, and I'm also a certified lactation expert. I am a heartfulness meditation trainer. So given the three, I have been able to spend a lot of quality time with mothers who have been pregnant, mothers who are in their lactation journey, and the mothers who have just tipped over their lactation journey to help weaning their babies and introducing the right foods to their babies. So nutrition, lactation, and baby care have been my profile. And as Mayank already said, that I have had several lactation cases where we have been able to successfully help a mother to relactate. What I mean by relactation is a mother who probably has stopped lactating, and then she decides, after 2 months, after 3 months time, that she wants to begin lactation again. So there are those kind of success stories also. So any mother who feels that she has got less milk supply, any mother who feels that, probably she is not able to manage and that's why she cannot and she stops feeding her baby. And those mothers probably who feel that they want to restart, please join our sessions and I'm sure it's going to bring you some definite smiles, right? Okay. So having said that, some expectation is like this, that every mother should know that breastfeeding is very easy, right? I mean, my mother-in-law and her mother-in-law probably felt कि breastfeeding में क्या है? No, anybody can do it. But only slowly and gradually, probably when I was delivering my first baby, my baby cried on the second day almost for half a day. And I just was so out of my mind because I was worried about why is the baby really crying. There was milk in my breast. The baby was nursing. The baby but was passing motions almost after every feed. And it was a big challenge because I was wondering in one day what can really go wrong with the baby's tummy, right? But often it is so that the baby is still trying to learn to adjust with the milk that is coming in. And that day, the baby is transmitting what the baby really requires and what its tummy is going to be able to digest. And by day 3, again, there was, of course, a lot of milk because I kept feeding the baby. And I realized the baby started, accepting more feed and the diarrhea reduced without any medication. So it is like, if you give time, if you allow the breast milk to really work and also work around, creating the baby's immunity, creating the baby's readiness to accept and also not giving up. All of this three put together, probably, I'm telling you, I cried also along with my baby that day because I was wondering, where am I going wrong? Right? It's not that I didn't know what I know today, or maybe I know a little more than what I knew then. But at the same time, when it is a mother, sometimes she doesn't think about her knowledge. She just is more worried about her baby, right? I hope I am trying to probably relate to what all you must be going through by now. So there are times that, you may have some challenges, but with little help, you can, overcome those challenges. And that's why I feel Baby Nama is trying to do this big thing, like, bringing in mothers who have probably some idea of what they should be doing, but they aren't sure whether they are doing enough. And that's where we come in picture, right? So it could be that, you feel that there is low milk output. You feel that there is, or rather you are going through any kind of breast pain, any kind of inflammation in your breast, or the baby is latching and you just can't manage because the baby is biting you at the breast. Probably at home, you don't have enough support, right? You don't have parents or you don't have elders who would be able to handhold you through the lactation journey. Maybe while you're feeding, your position is bad, your posture is bad, you can't sleep, you don't get enough sleep, and you are having aches and pains. Probably you feel that you are generating less and you start giving formula and you can't bear the expense that the formula is bringing in your everyday's, monthly output. Or probably it could be some baby's issues that the baby has got a tongue tie. It could be that there is some illness, the baby was born early, there is an NICU, there can be several things, right? So it's a given situation, and from that situation, how we can actually bring ourselves to be able to successfully breastfeed is what we want to learn. So let's make it happen, right? At Baby Nama, what we've seen is close to about 90% of new moms who have come have had breastfeeding challenges. A few of them, around 60%, had low milk supply issues. There were 45% who probably came with a painful breastfeeding experience. And imagine close to about 80% of all who came to us and who had latching issues got done and, were able to solve their latching issues with just one consultation. That's only because you probably didn't realize why the latching issue is, right? So just trying to give you an idea of how simple it can be to, get out of pain or to get out and, try and get little more milk in the breast to make sure that the baby is getting enough is not very difficult. All you need is a little help and a little understanding. And of course, some amount of working around what is suggested. Yeah. So we all know that breastfeeding is essential and it is possible. Okay. So while we talk about the benefits about the breastfeeding for the baby, nothing can be nutritionally best compared to breast milk when it comes for baby's nourishment and nutrition. Okay. This breast milk is going to promote a huge amount of immunity benefits to your baby, not just today or at birth, but for a lifetime. So right now the baby starts developing its immunity, and that immunity is going to also take care of any kind of illnesses, even in later life. Yeah. While the baby nurses, there is a mouth, a jaw, and a tooth, all of it which is trying to, get worked. And that is going to be adequate exercise for promoting better jaw and tooth development in later life. And these babies basically have always had better eyesight. They have had better intelligence scores. They probably have had better, cheek line. They don't have longish cheek line. They have better cheek lines because of this activity that has really happened. And imagine breast milk is made then and there, right? So while the baby nurses, that's the time the breast milk is in the process of being made, and same time it is also being delivered to the baby while the suckling is happening. So it's not like, kept for days together, like probably you will have a container having formula, or it's not like you express today and you're, giving that milk to the baby after 15 days. It's not like that, right? So it's more like fresh on demand, and which is why it will have the right nutrition required today, right? If my baby is 15 days old or if my baby is 3 months old, what milk I make is going to be exactly what the baby requires at that age. So a 15 days baby will get a composition that the 15 days baby can manage to digest. Similarly, the composition of milk would change when the baby is 3 months of age. Probably the quantum is increased. The amount of fat, carbohydrate, vitamin portion has changed depending on what the baby requires. So which is why we try and push very hard on, continuing breastfeeding come what may. Yeah. And we know that it's not just for the baby's benefit, but the mother has immense benefit by feeding at the breast. All these issues which you're seeing around can be managed. So mother may not have major osteoporosis disorders later in life, no breast cancers, least chance of having cervical cancers. The mother will start losing weight as she keeps feeding. Okay. During the pregnancy, the body starts storing a lot of fat. Okay. And this fat is stored with an understanding that the body will utilize it to generate the energy for milk production. Now, if the mother doesn't feed, she will keep storing all that fat. But if she feeds, this fat is going to be utilized. Okay, so she is going to be shaping up faster. Okay, without trying to not eat or without reducing her food intake like crazy. Probably not trying to do a lot of exercise so that she comes back in shape. This will naturally help the baby mother to come back in shape. Also, we have seen that after delivery, the mothers or all mothers probably bleed for at least a period of 8 days, 10 days. Some bleed even up to 3 weeks time. Now, why does this happen? We all know that there is this blood lining in the uterus, which is, stored for the entire period of 9 months till you are pregnant. And once you deliver, this lining starts breaking up. Okay. Now, when this lining breaks up, there will be some flow that is any which way is coming. Right. But what happens is the baby is embedded at this place, somewhere in the uterus, right? So from where the placenta is torn off is the place where there is going to be more blood loss. More number of endings of blood is going to, keep leaking. Now, if that is happening, the mother will lose more blood, isn't it? Now, if the uterus is like, or rather the uterus becomes so large to accommodate the placenta, the amniotic fluid, the umbilical cord, and the baby. All of it is within this uterus. Now, this uterus will start shrinking gradually from day one or after delivery time. But if this oxytocin is available, the uterus shrinks faster. It becomes the size of a cricket ball in about 3 to 3.5 days. Imagine this large to this size of a cricket ball. And then only that much of a surface area is where the blood endings are. So, very quickly within say about 4 days time, you start bleeding less. You will be able to save a lot of blood. You will not feel tired and you will have enough energy to manage your babies. Isn't that beautiful? Right? Also, again, breastfeeding is something which develops a lifelong bonding between the mother and the baby. So let's do it, right? We want to keep that bond for a lifetime, never forgotten in life, right? We've also seen that mothers who breastfeed will not have depression after delivery. So is this not all enough for us to, be motivated enough to breastfeed our babies? I'm sure we are, right? We also seen that, there are economical and societal benefits around breastfeeding. Imagine how many mothers probably are already giving formula to your babies. If you can start typing in the chat box. I need to see that. But yeah, okay. Keep going. Are there mothers who are already giving formula? I don't see anybody. Okay, twice a day. I see one mother saying twice a day. Twice a day, 90 ml. Any more mothers from the entire lot today who are feeding formula already? Okay, okay. Both formula and breast milk, great. 3-4 times. Multiple times, okay. Twice, 60 ml twice. Twins, yes, you might need formula. Only at night time. 3 times a day. Okay. So what I'm seeing around here is there are several mothers who have been needing to give formula, right? Now, having said that, if we need formula, it's not going to be cost-free, right? The breast milk is cost-free, but the formula will have some cost to it. Okay? And it's not just the formula, it's also what you use to feed the formula. It can be a paladai, it can be a bottle, it can be a nifty cup, it can be a katori vati, which you're going to keep for the baby. And you need some more paraphernalia to keep the sterilized things ready for being able to feed, right? All of this involves cost. Now, why I'm saying that is not because mothers won't want to spend that amount for their baby's requirement. But imagine if you were able to breastfeed, you might not need to spend that, right? So that's one thing which we need to understand. Also, formula basically will have some amount of sugar in it, which the breast milk may not. No, there will be a little lactose, which is just tolerable by the baby. It will not have an additional amount of lactose, which probably can cause loose motions to the baby. Right? We've seen that, there will be lesser admission rates in the hospital because the baby is able to digest breast milk easily as compared to when the formula is given. So often we've seen that, even at home, while you're giving formula, people will question you that, "Arey, you don't have enough milk." So, it hurts, isn't it? What if my neighbor is going to come and tell me, "Oh, you require so much formula every day"? What if my mother-in-law is thinking, "Oh God, she doesn't have milk"? It's very painful. Now, it's not because you are trying to do something wrong. It's just that you need some help, right? So please seek help. Don't feel inhibited. That's what I want to tell you on this slide, right? So, okay, this is not moving. All right. So just trying to give you an idea of how the breast really makes milk. Now, there are these several alveoli, which we call, these are the milk producing sacs in the breast. Now, these producing sacs will work in response to two hormones. Okay, so let me go to the next slide. There are these two hormones, prolactin and oxytocin. Now, when your baby starts sucking at the breast, what happens? There is a signal which is going to go to your brain. Your brain will process that signal. It will send a signal to your pituitary gland. And your pituitary gland will generate these two hormones in response to this suckling reflex. Okay. This prolactin is going to allow milk production in your breast through the alveoli. And this oxytocin, which I mentioned, this is going to allow the ejection of milk from your breast. So there are two things that are happening. When the baby sucks from the breast starts making more milk. And when the baby sucks, the oxytocin allows more milk to get transferred into the baby's mouth while it is sucking. Both are going to happen hand in hand. So imagine if the baby is latching well, automatically both will happen hand in hand and there will be no dearth of milk supply because there is continuous production and there is also continuous removal of milk from the breast. How else can we achieve that? There are times when the baby doesn't latch well. There is a painful latch. There are times when the baby is not efficient enough to suck more milk. Baby is a NICU baby, is born premature. There could be several challenges like that. In such cases, there is a chance that you start expressing from the breast. When you express, you are still trying to give the same signal because the milk is still coming out from the breast, right? So the same signal is going to the mother's brain. The same signal is announcing to the pituitary to keep producing prolactin to keep making more milk. So we are trying to do two things parallelly. We are also allowing the baby to suckle, but we are also pumping or we are expressing from the breast. This will ensure that you are able to maintain a supply, right? So entire process of breastfeeding or lactation basically works on this principle of demand and supply. So more the baby is sucking, you will definitely have more milk. But if there is a problem in allowing the baby to suck, which could be very many, right? I'll come to that in a couple of slides. It could be very many and a lot of them can be addressed very, very quickly and they are solvable. So please understand, don't sit back thinking nahi ho raha hai and keep stuck into the formula trap, right? There could be several factors which affect breast milk production. Can be because of mother's ailment, could be mother is not well. There is a lot of stress. If there's a lot of stress, the oxytocin doesn't work. That means even if there is milk in the breast, it doesn't get released. Now, what will you do? You will have tighter breasts, but you can't still feed the baby. What is required is a session on relaxation, not trying to increase breast milk. If you increase breast milk in such a condition, you will have very hard breasts and it will get more painful. So, if you know where things are going wrong, you can just work and it just helps you, right? It could also be probably during delivery, there has been a problem. It can be baby factor that the baby is not holding well, not sucking well, the baby is premature, the baby is low birth weight, has not got enough power, is having a tongue tie. Any of these reasons could be the reason for affecting your breast milk supply, right? It could also be that you're feeding lesser number of times than required, right? The ideal that we look at is in the first 15 days, it is demand feeding. The baby may ask at 1 hour, the baby may ask for food at 2 hours, the baby may sleep a little longer. Some babies are up for 4 hours together and sleeping for the next 4 hours. So first 15 days, it's more on demand. Gradually, it becomes more like a 2 to 2.5 early feeding cycles, and which need to be established consciously, right? Otherwise, you start, putting formula. Nahi ho raha hai, formula dal do. The moment you put formula, the baby will suckle less because it is getting easy milk, right? So don't fall into that trap. We know that, breast milk has this colostrum which starts, when you start feeding, the first milk that comes is colostrum. It's the richest milk that you can give to help the baby's immunity go beyond par. So don't miss that, right? That is why I know a lot of mothers are joining who are pregnant right now to be mothers. If you start early at the time, within 1 hour of your delivery time, which we call as a golden hour, you will be amazed to see how well your baby learns to suck and how well you start producing milk, because more the baby sucks, more milk you get, right? So if you start immediately after birth, the baby is able to get the maximum amount of colostrum, right? Baby will have beautiful immunity development, which will help it across a lifetime. Gradually, what happens is there is a transition in the milk. So this yellowish looking, sticky, palish, opaquish kind of milk turns into a transition milk, which of course is as good because, as I said, as the baby's age, there will be change in the milk composition depending on what the baby requires then. So there will be a gradual transition as you keep feeding the baby consistently. Yeah. So that's why if you give that initial milk, what happens is this liquid gold is what we call this colostrum, right? This milk is going to make sure that the mother makes more milk. And it is also going to make sure that the baby has the best immunity. And third thing is that it will also help to establish the baby's blood glucose levels after birth. So imagine it's going to do a lot, right? Again, the composition of breast milk, as I mentioned, it has got, say, about more than 200 bioactive compounds, all of this which are put around here. So these are going to take care of the baby's gut health, the baby's digestion, the baby's overall growth and development. All of it is going to be taken care of while it is going to be breast milk. And again, do you feel breast milk is only to fill the baby's bellies? Any answers? Anything in the chat box? Do you feel खाली पेट भरने के लिए बच्चा फीड करता है? No. Okay, one answer is no. There are a few more. No. Yes. Yes. Okay, building immunity leads to their development. Fantastic. So when we look at breast milk, what is happening is breast milk is going to allow not just as food, but it is going to take care of the baby's security, the baby's warmth, the feeling of love, the feeling of being connected to the mother. So many more parameters are being met, right? While you're holding the baby close to your body, are you not loving the baby? Are you not giving the right temperature to the baby? Are you not trying to give the baby a feeling of security? Oh, itna sara awaaz hai around the place. But when the baby is in your arms, the baby feels very secure, right? And when the baby feels secure, the baby is able to, feed well, suckle well, and be very happy. So it's not just food. It's so much more than just food, right? Okay. I had so many answers. Thank you, mamas, for please answering. And that allows us to keep going better, right? So why do we not want to give formula? Just for these specific reasons that formula can be contaminated and spoiled, but mother's milk is made fresh. It can never be spoiled, right? And as I said, the breast milk basically is made according to what a spit backwash we call is, like how the baby transmit what it is requiring. And that kind of trigger will allow the production of better leukocytes in the breast milk. Okay. We've seen that babies who are breastfed don't have issues like diabetes or other any infection related problems later in life. And we've seen that, close to about 100 grams of formula may have about 40 grams of carbs, more than 40 grams of carbohydrate. So in such case, why do we want to give something like that, right? Okay, this is a little story that I want to say. Imagine if you have a baby, or I'm sure a few of the mothers who are here probably have a baby and the baby is crying and is behaving cranky quite often in a day and the mother is perplexed, right? I'm sure I have a few mothers like this. Yeah. If you have questions on those kind of things, please put a yes in the chat box. All right. Okay. Thank you. Thank you. So many moms actually need to know this. So just trying to give this understanding, what is really happening. This basically is a formula trap. Okay. Now imagine you think that you're making less milk. Maybe you're really making less milk. What will you do? You will start topping with formula, because if there is less breast milk, you can't keep the baby hungry. Now, if there is formula, what is happening? The baby feels full, or rather over full, and it sleeps longer, right? Now, if the baby who's sleeping for 4 hours at a go, what happens? The baby will come to the breast less number of times because it is sleeping. It will not suck. And the lesser it sucks, what happens? The breast starts producing less and less milk. We know, like I explained in the last slide, or a couple of last slides, that lesser the suckling, lesser will be the milk production. More the suckling, more will be the milk production, right? So if the baby is full and the baby is not hungry, why will it suck? And if the baby will not suck, you will start making less milk. And then what happens? You will keep feeling that you are making less milk, and you will keep giving more formula, and you will keep getting stuck in this cycle, and probably you will start giving all formula. I hope we don't want to get there, right? So we need to recognize what are signs of hunger and put the baby to the breast at the right time, which will ensure that the baby suckles properly without getting annoyed. Okay? A baby who's very hungry will start crying. And if the baby is crying before you bring the baby to the breast, you have lost the battle, because imagine ये एक बच्चा है, उसका मुंह खुला ही खुला है. Where will it, or how will it latch? If the baby closes its mouth, only will it be able to latch, right? With an open mouth, it will never suck. So we cannot wait till the baby gets hungry. You have to recognize the signs before the baby is hungry and bring the baby to the breast early, before it is like starting to get annoyed. Correct? Mhm. So you need to recognize the cues, right? What will you recognize, or how do you know that the baby is hungry? Baby will start looking even with closed eyes, open eyes, it will keep looking here and there. Then it will start making mouth movements. It may start sticking its tongue like this. All these are trying to tell you that, okay, isme kuch dalo. Please put something in my mouth. I am getting hungry. But if you miss those, baby will start making noise. Initially, ooh, ah, ah, trying to bring your attention. If you miss that, the baby will start howling and you have lost the battle. Okay. So all these signs, very, very important to make sure that the baby latches and you get successful breastfeeding experience. Right? Okay, where are we? So to understand how to latch correctly, let me just demo it so that we are there rather than trying to talk about it. Correct? Okay, I'll put myself on pin so you can see me well. Right. Okay. So now that you have your baby in hand, you should know there are a couple of positions that you should be able to understand to hold. Any position that is good, or rather that is comfortable for you, is good for both you and your baby. Okay? When you hold the baby in your elbow, or you hold the baby in your arm, but you're feeding on the same side as the arm that you're holding, it is a cradle hold. Okay. If you're holding the baby with the arm opposite to the side you're feeding, it's a cross cradle hold. Okay. If you're feeding the baby like this, put the baby behind. This is a football hold. If you're going to put the baby over you and feed like this is a laid back position. There are some few more positions which probably mothers can learn and experience, but these are the most common ones which are used by most mothers. Okay. Now to give you how the latch really happens. Usually most mothers go easy when the latch is being done in a cross cradle hold. Why? Because the mother is able to put the baby touching her own abdomen. The baby's legs are behind and the mother's arm is holding the baby's leg in position. Hope you're able to see me. Yeah. Then the baby is probably straight touching your tummy. You have to see that the baby's head, the baby's shoulder, and the baby's hip are all in a straight line. And then the baby is coming to the breast. Now, when you try to bring the baby to the breast, what you should seek or understand is this. Okay. Pull the nipple a little above while you're trying to bring the baby to latch. Okay. Now, this nipple is now pointing the baby's nose. Okay. And what you see is the baby's chin is thrusted into the breast like this. Okay. Now this is close to the baby's nose. Baby will start opening its mouth because the nipple is touching the baby's upper lip. Okay. The baby will start opening its mouth, and mouth is going higher than the level of the nipple. Here is when you bring the baby closer. Okay. With the open mouth, this nipple will popple into its mouth, and that's where you also release this hold that you are having. Now, what is going to happen because of this is the baby is going to hold a larger part of the lower areola. And because you have released this, the baby will not latch at the base of the nipple, but a little beyond the nipple. So this is how the baby's mouth will come to the breast. Now imagine when the baby starts nursing, what happens? There is this part of the nipple is free inside the baby's mouth. If the baby latches here, what happens? This thing is touching the baby's palate and there is a lot of pain to the mother. If the baby is holding like this, there is no pain to the mother and the baby gets more milk because the baby is latching far beyond with a little more areola in the mouth. So that's how a successful latch really works. No pain and a lot of milk to the baby with less effort. Are we not wanting this? We are all wanting this, right? So maybe that easy it is. And that's why we said that, if you are understanding this much in one go, probably you can have a beautiful lactation journey ahead, right? In case, that's why I'm saying, in case you feel that you need to know more, if you are going through some trouble, please, please, please don't wait. Come back and I think we'll be able to help you latch well so that you have, you are able to feed more directly at the breast than get into a formula trap or, keep feeling sad about not being able to do so, right? All right, where are we? It was just went by. Okay, so these are, as I said, a signs of correct latch. How do you recognize whether the latch is fine? The baby's head has to be tilted a little backwards, like this. If you tilt your head further, if baby's head is tilted like this, the opening of the mouth is restricted. The baby's head is tilted like this, there is ease of baby opening the mouth wide enough while it nurses. Okay. Second is, or rather the third is the baby's chin is thrusted into the mother's breast. So the opening becomes easy and there is adequate lower part of the areola in the baby's mouth. Okay. You see that the tongue will be able to move well when the latch is good. Otherwise, the tongue probably keeps pressing the nipple, right? And last, what you see is the baby's nose is a little away from the surface of the breast. So there is no breathing difficulty that the baby experiences while feeding. What if it is a wrong latch? This is what you will see. Pain while feeding. The lips will be rolled inwards or it will be in circle like this. You will see a smacking sound or a click, click, click sound while the baby is suckling. It would be like, as I said, the baby is, chewing on the nipple while it sucks. So it's really very painful, right? A biting sensation. Sometimes it could be compression that happens in the breast after the feeding is done. Or the baby leaves the breast very frequently and there is lesser or no weight gain. All of this could be indicating that the latch is not correct. And by knowing exactly what I really demonstrated, if we are able to do that, you will ensure that all of this just gets solved. Yeah. Why this stops? Okay. So how do you assess if you are making enough? Few mothers may know, but let me repeat, right? There has to be a minimum of 6 to 8 urinations in an entire day to ensure that the baby is well hydrated. You have to also check the weight gain per month. right? The baby has to gain 150 grams per week, or say close to 500 to 750 grams per month. Okay. And if the baby is latched well, as I mentioned, if the baby is latched deep, there will be good amount of milk that the baby draws from the breast. So there is better transfer of milk, filling the baby's stomach up and definitely making sure that the baby gets higher gain in weight. Okay. Baby may sleep well without trying to keep doing that movement all the time. You'll also see that the baby is moreover happy. It's not like cranky, so that the mother doesn't understand whether it's hungry or sleepy or what to do with this baby because it's continuously cranky. Correct? So we need to also know what you eat for that. A dehydrated mother, a mother who does not have the nutrition right, probably may not be able to feed enough. So for you, it is important to make sure that you eat so many foods, which are all put on this slide. You can take a screenshot if you want. But trying to eat these foods in the right time really works. Going hungry for 5 hours at a go just because the baby didn't sleep, just because the baby kept on suckling and kept on behaving cranky, probably is not helping you, right? Please seek help, get somebody to hold your baby so that you can spend those 5 minutes to eat. Come back so that you will make more milk because you've eaten enough, right? Also, you can include things like fennel. Fennel seeds work fantastically. You can use fenugreek seeds. There are other foods like oats, barley, yeast, etc., which help. There are certain things like ajwain and ginger, etc., which help to calm down your own system so that you are not bloated and you feel good in your own body. You need to be well hydrated with water and with other liquids to give you the energy to continue your day's work, right? Managing the baby is a lot of work. Yeah. Okay. When to seek support. Okay. If you have any of this issues, like if the baby is small or preterm, if the baby is sitting at the breast for 1 hour and still feeling hungry, if probably the baby is vomiting after every feed, if the baby rejects the breast, all of these could be reasons. These are all red flags and you need help. Yeah. Otherwise, some other red flags could be a painful latch, a poor latch, feeding longer time, low milk supply, engorgement, clogged ducts, blebs, any kind of infection. Please reach out to a lactation counselor. They would be able to help you very, very quickly. Yeah. So maybe a few take-home messages would be all of this. Anything can happen during a lactation journey, but there is help. Okay, a lactation expert has learned so many things in her learning experience. And for if I talk about myself, I must have seen over 6,000 women pregnant and lactating, and I have had different kinds of experiences to probably pull in all those learnings to kind of help and bring it to the table when I'm helping a new mother. Yeah, we've seen that in case there is fever with engorgement, what you should do, should reach out. आपकी breast एकदम heavy हो गई and you're turning, having higher temperature, you may feel very, very tired, right? You can't feed and there is so much pain. And in such case, if you're just still sitting, it's going to be, even more losing your head. Okay? It's important to give a lot of skin to skin contact for the baby. Don't fall into a formula trap. Treat breastfeeding issues as an emergency. Okay. And any kind of stress probably never helps the breastfeeding journey. You probably will have low milk supply continuing because the stress hormones are trying to interfere with the generation of milk, right? So invest wisely in yourself and the future of your baby. I think that's all that I needed to say, and I'll wait back for questions. Thank you so
Okay.
much for joining.
Thank you, Swati ma'am. And we hope all of you had a lot of useful information. We have a lot of mothers joining in today, and I'm sure they can't wait for the Q&A to start. But before we go to Q&A, I'll take 5 minutes of your time.
Can
Yes,
I
yes,
take
Swati ma'am.
1 minute before you start?
Yeah, sure.
How many mothers have bottle of water with you? We are talking for 30 minutes now. How many mothers have water by their side? Okay, okay,
Does
okay, okay.
does tea
Cool.
count?
That is liquid, but yes, it does count.
Okay. Yes.
Okay, so you know why I'm trying to say that? A lot of mothers don't remember to stay hydrated. So this is one way of, putting that bottle next to you so that you keep sipping and you keep your body well hydrated. And please,
Yeah.
all the way yours, Mayank.
Okay. Yeah. All right. So before we move to Q&A, I'll take 5 minutes of your time and tell you how Baby Nama has been helping thousands of mothers in their breastfeeding journey in a natural way. Uh, so we are doing this with the help of our breastfeeding training program, right? And what we realized is, with a lot of effort, we realized that lactation is mostly a personal journey. The personal problems need one-to-one consultations, and that's why we have developed this program where you get unlimited support from lactation experts in your breastfeeding journey. Okay, so how does this 1 month breastfeeding training program work? So as soon as you enroll in this program, our team connects with you, understands your goals, current problems, and based on that, the process starts. So you say, okay, my current problem is I'm giving too much formula to my baby, and my goal is to, express enough milk so that even when I'm going off to work, my baby can be given my milk, right? After this, the first consultation happened with the expert, where the expert understands, okay, you are right now here, you want to go here. How do we go from here to here? What is going to be the trajectory? What is going to be the plan of action? What kind of diet do you need to follow in order to achieve that? Okay. After the first consultation, where the plan is drawn, after that, a private group is created with the expert, and then the expert kind of gets daily feedback from you. So every day, the expert will ask you, okay, how much time did you feed? What amount of formula did you give every time? How much milk were you able to express? And then all those numbers, based on their experience, they'll try to understand if the journey is on the right track or not, or are you swaying away from the path which we had taught. If at any point of time they feel that, okay, you are not on the right track, they say, okay, let's come for a consultation, because you get unlimited consultations with this program. And after some time, when the experts have assessed that everything is going fine on the right track, so then there will be weekly assessments. So every week, the expert will just assess if everything is still going right or not. Okay. Now, till now, we have helped over 10,000 mothers with the help of our experts in their breastfeeding journey. We have a stellar team of top qualified lactation experts. And while it's a 1 month long program, everybody has reported improvements just after the first consultation. And till now, 97% of the mothers have been able to go from point A to point B. That is where they wanted to be, or at least they see themselves reaching there. Okay. Now, there are some obvious questions which mothers ask. So, this program doesn't prescribe you any medicine or any supplements. In fact, we mostly have the standard you don't need it unless in a very rare case home cooked diet is sufficient. So this is what a lot of mothers ask us: why, how can you increase my milk supply without any supplements? Okay, so A, right nutrition is necessary, but it is not sufficient, right? It's not sufficient. If you have right nutrition, doesn't mean that with latching problem and everything you will be able to breastfeed. Okay, I mean, agreed. If the nutrition is not right, nothing can work. But even with proper focus on nutrition, your baby needs to latch well, because once you resolve the latching issue, automatically the entire body system starts functioning smoothly. Your brain gets the information that you need to produce more because your baby is demanding more. So remember, the holy theorem in economics and breastfeeding is demand equal to supply. All right. So if the baby demands more, your body will automatically increase the supply. Okay. Obviously, in certain cases, in our experience, only like 10% of the cases, there is some nutritional deficiency where we prescribe a specific diet, and only 1% cases we will prescribe some supplement very rarely. Okay. So I would like to share this message from one of the mothers, Suparna ma'am. So she came to us, she was saying that I have low milk supply, please give me the right diet. So then our expert said, you don't have low milk supply because of nutrition. It's happening because of latching issues. So her latching was corrected Also, she was using pump. She's a working mom, so she had to use pump a little bit. So our experts taught her how to use the pump correctly, and now she's actually having a surplus milk supply. So as you can see in the photo, she was so happy that day that she said that, "Okay, now I have a surplus." Okay. Uh, Other thing which a lot of mothers ask is, will online consultations work? Like, how can you guide me if you can't even come and explain me? Right? So just like our experts have demonstrated here through doll, first, through video consultation, they can understand what the baby's issue is, and second, they can demonstrate you how to do the right latching or position with the help of doll. In fact, online is better because both you and the baby are in a comfortable environment. You don't have to travel somewhere outside and expose your baby in this crucial time to the outside bacteria. So online is actually more preferable. Okay? So here I am just sharing a few success stories of mothers who were just as doubtful as you after the first consultation. So Roja ma'am has said that, I'm glad I met you for latching concern. You have provided me a quick solution. So her latching problem was solved just after the first consultation online. Right? Madhu ma'am's low milk supply was solved. Okay. Anika ma'am's pain issue was solved. She had pain during latching. Simantini's ma'am was unable to get enough milk, so her milk supply went up by 12 to 15 ml just after the first consultation. Now, we at Baby Nama realize the importance of every milliliter. Every milliliter is a small victory, and this is not the end of her journey. She's still the all of these mothers are still working with our experts, and we are sure that they'll reach their goal. Okay. And Diksha ma'am, she wanted to pump, but her pump she was not able to use the pump efficiently. So she got the right guidance on how to use pump. And here's a very important thing. She said that you've been a better help than doctors, right? And I'm pretty sure a lot of you must have gone to your doctors about this problem. But unfortunately, the art of breastfeeding is not taught even to doctors. The science, the theory of breastfeeding, they understand. The baby is born, hormones are released, breast milk is produced. But the science, the practical part of it is something which doctors even don't understand, right? And that's why, because it's a science which is an art, it takes time to solve. It takes 1 month. So here I have a testimonial from one of the baby Nama mothers who's actually a doctor herself. All right, so she's a doctor, and just let's just listen to what she had to say.
So I'm Dr. Sushmita and I'm an anesthetist. And being a doctor also, though I knew about the theoretical part of breastfeeding, its advantages and everything, but I very little knew about the lactation part. So I had an emergency section at 36 weeks. I delivered a baby boy, and like most of them, my hospital people also didn't let me latch my baby in the first day. So I had to give formula to my baby for 3 days, and then I was trying to latch my baby. And same like many of the first time mothers have, my baby was also not latching, and I also had a flat nipple. So I tried many things. I tried syringing, I tried pumping, and I had cracked nipples. All this has happened to me. And I think on day 6, I came across Baby Nama, and I had my call with Vinotini mom. I still remember June 10th, I guess. So she told me what was the problem. The positioning itself was very wrong. How was I holding my baby? How was I trying to bring my baby to my breast? So then I came to know that my baby was having this flow confusion rather than the nipple confusion. So each palad I feed, I started giving 15-20 minutes like that. And slowly, I think on day 11 or day 12, my baby started to latch, and thank goodness. And slowly, everything has become normal. So now my baby's latching perfectly. Everything is good. Baby's gaining weight. Mothers, please, whoever are anxious, don't be anxious. Don't stress yourself out as I did. Please, and your milk is enough. Your baby will feed. Your baby will latch on you. And today is day 28, and I can see how it has changed for me. And I really think all the mothers out there, please don't lose hope and go into this formula trap. and really thank baby Nama and mom especially. So I'm Dr. Sushmita and
Surgical on C, she's a doctor, and she had a C-section delivery. She had flat nipples, cracked nipples. She tried pumping, uh, but despite all the theoretical knowledge, she was unable to feed the baby. But when she came to the experts, she was able to see results from day one. By day 11, there was perfect latch. Till day 28, everything is resolved. Okay, and that could be you. So, this is the breastfeeding training program. I'm quickly dropping the link in the group chat for all of you to see. Those who are on Instagram or YouTube, you can check out the bio, and you can use coupon code FEED20. Okay, so FEED20 is the coupon code, and let's move on to the Q&As. Uh, so let's go one by one. So those who have a query, you have to raise your hand. I'll be taking queries about the program later on. But right now, we will take queries from the mothers about breastfeeding. Please do mention your baby's age in screen name in order to ask the questions. Switching on the camera is mandatory while asking the question. So let's go to Kiran ma'am. Hello, Kiran ma'am. Can you switch on your camera and unmute yourself? Okay, wait. I should have given the permission. Sorry, my bad. Yeah, yeah. Please try now, Kiran ma'am. It should work. Yes, Kiran ma'am. Yeah.
हाँ सर
Yes,
सर
you are
मेरा
audible.
बेबी हाँ जी सर मेरा बेबी 2.5 मंथ का है। वो ब्रेस्ट फीड लेता ही नहीं बिकॉज मेरा सिजेरियन हुआ था 8 मंथ में हुआ था बेबी मेरा 8 मंथ एंड में। बट ये ब्रेस्ट मिल्क लेता ही नहीं है। सिर्फ ये फॉर्मूला मिल्क पे ही है स्टार्टिंग से। मैं थोड़ा बहुत निकाल के देती हूँ लेकिन अब तो मिल्क भी बहुत लो हो गया है। तो क्या ये ब्रेस्ट मिल्क पे आ सकता है?
Swati ma'am, you're on mute actually.
ओके किरण जी, नॉर्मली कैसे होता है जब आप बेबी को ब्रेस्ट फीड देने लगते हैं या बेबी ब्रेस्ट पे सकल करता है तो ज्यादा दूध ब्रेस्ट में बनने लगता है। अगर नहीं सकलिंग होगा तो ब्रेस्ट मिल्क कम हो सकता है। बट अगर बेबी लैच नहीं कर रहा है तो जरूरी है कि आप एटलीस्ट पंप करें ताकि ब्रेस्ट मिल्क का सप्लाई बना रहे। अगर दोनों में से एक भी चीज
ब्रेस्ट
नहीं
मिल्क
हुई है।
बहुत लो हो गया है।
जी,
ब्रेस्ट मिल्क तो अब आ ही है मतलब बहुत ही कम आ रहा है बहुत ही कम आ रहा है। और ये मतलब कि शुरू से इसने इलाज किया ही नहीं है ब्रेस्ट मिल्क पे आया ही नहीं है।
नहीं
बिकॉज मेरा
आप।
सिजेरियन हुआ था 3 दिन
हम्म।
रहा था ये उसमें तो उसके बाद जब मुझे मिला था तो बहुत मतलब कि जब ब्रेस्ट मिल्क लेते थे तो बहुत रोता रहता था लेकिन दूध नहीं पीता था। तब उसे फार्मूला दे देते थे हम। तो देन तब
नहीं,
से
मैं
ऐसे
आपकी
ही होते
बात
आ रहा
समझ रही
है।
हूँ किरण जी, लेकिन कैसे है, लैच करवाने को हम सिखा सकते हैं। अगर लैच करवाने को आप सीख गए तो ऑटोमेटिक पूरा काम सॉर्ट हो जाएगा, है ना। अगर बेबी ने लैच
हम्म
कर दिया तो ब्रेस्ट मिल्क बनना शुरू हो जाएगा और रादर ज्यादा ब्रेस्ट मिल्क बनना शुरू हो जाएगा। धीरे धीरे ब्रेस्ट मिल्क की क्वांटिटी जैसे बढ़ेगी वैसे वैसे आप फॉर्मूला कम कर पाएंगे। अभी फिलहाल क्योंकि
हम्म
लैच नहीं कर रहा है तो कम से कम पंप करना शुरू कर दीजिए। और अगर आप कोशिश करके एक बार हमारे साथ कनेक्ट कर सकते हैं थ्रू द प्रोग्राम तो हम आपको लैच करवाना सिखा देंगे। सो आपके लिए आसान हो जाएगा कि अभी फिलहाल
मैम
पंप करके थोड़ा सप्लाई मेंटेन कर लेते हैं, जितना भी आ रहा है एटलीस्ट उसको मेंटेन कर लेते हैं। बट लैच करना शुरू अगर कर लिया ना तो आपका बहुत सारा ट्रबल सॉर्ट हो जाएगा।
मैम बहुत ही कम आ रहा है मीन्स आप कह सकते हो मतलब 2-3 ml है जैसे ड्रॉप से देते हैं ना लाइक इस तरह से हो गया मिल्क।
अच्छा, देखिए मैं एक एग्जांपल
तो
और
2-3 ml की जगह
करेक्ट, मैं एक और एग्जांपल और
मैं
देती हूँ।
कोशिश करती हूँ
आपने कभी
निकालने की।
आपने कभी ऐसा सुना है कि जो मदर ने बिल्कुल फीड ही नहीं किया, जैसे आप बोल रहे हो कि बच्चे ने लैच नहीं किया, वो मदर ने 6 मंथ्स पे डिसाइड किया कि अब मुझे फीड करना है, तो उसको भी नहीं आ रहा होगा, राइट। बट वैसी मदर ने भी
हम्म
एटलीस्ट आधा दूध जो बच्चे को चाहिए था उतना बनाना शुरू कर लिया था बाय अंडरस्टैंडिंग के कैसे करना चाहिए। तो आप भी कोशिश कर ही सकते हो, ऐसा नहीं कि 0 मिल्क है, 2 ml भी आ रहा
मैम
है ना,
आपकी वॉइस
दिख
नहीं
रहा
आ
है।
रही, ब्रेक हो गई है।
मैं कह रही हूँ कि अगर 2 ml भी आपको दिख रहा है, दैट मीन्स दूध तो आ रहा है, राइट? तो उसको हमको खाली बढ़ाना है, और हम ये
मैम वो
बढ़ा
देती
सकते
हूँ,
हैं।
मैं निकाल के कोशिश करती रहती हूँ। यस मैम।
हाँ, सो अगर पंप कीजिएगा तो कैसे सिंक्रनी मेंटेन करना है, वो सारा चीज अगर आप अंडरस्टैंड कर लोगे ना, और उस हिसाब से अगर आप चलने लगोगे, यू विल बी वेरी हैप्पी कि आपने ये प्रोग्राम और आज का वेबिनार अटेंड किया।
तो मैम लेकिन आ सकता है ना, क्योंकि 2.5 मंथ का हो गया, काफी लोगों ने कहा कि अब नहीं आएगा।
नहीं
तो
नहीं, ऐसा नहीं
इसलिए
होता है, डेफिनेटली आ जाएगा। ऐसे मैं नहीं बोल सकती हूँ कि
हम्म,
जितना आप फॉर्मूला दे रहे हो उतना पूरा एक ही दिन में आ जाएगा, बट धीरे धीरे ब्रेस्ट मिल्क बढ़ बढ़ के यू विल बी रीचिंग समवेयर जहां आप अपने आप को खुश देख पाओगे। इतना जरूर हम बता सकते हैं।
मैम अगर ये पॉसिबल है तो मैं प्रोग्राम जरूर ज्वाइन करूंगी।
बिल्कुल, प्लीज मयंक जी आपको बता देंगे
यस,
आगे कि आप
डेफिनेटली।
कैसे
मतलब
अगर
अंडर
ये
थ्री
100%
मंथ्स
मतलब ये पॉसिबल
अंडर
चीजें
थ्री
मुझे।
मंथ्स वाले केस में, मतलब मैं कस्टमर से फीडबैक लेता हूँ, पार्ट ऑफ द कस्टमर सपोर्ट टीम, तो मेरे को इतना पता है कि अंडर 3 मंथ्स में 100% मदर्स हमारी हैप्पी है। दे आर हैप्पी एंड यू विल बी हैप्पी, so that I can
ऐसे
say
कुछ
with
करो,
confidence.
3 मंथ का हो जाएगा।
तो मैम आप वेट करते रहोगे तो 10 साल का भी हो जाएगा, बच्चा नहीं वेट करेगा बहुत ज्यादा, आपको एक्शन लेना है जल्दी। ठीक है, ओके। सो आपके ऊपर है, आप ज्वाइन कीजिए। आई एम प्रीटी श्योर हमारे एक्सपर्ट्स विल बी एबल टू हेल्प यू 100% इन less than 3 months केसेस, वो हमेशा भी हो
ओके।
जाता है। ओके, सो लेट्स मूव टू खुशबू मैम, खुशबू उपल।
हेलो, हाय सर।
हेलो
या
खुशबू।
प्लीज अनम्यूट योरसेल्फ एंड स्विच ऑन योर कैमरा।
सर मेरा क्वेश्चन ये है कि हमें कितने कितने टाइम में पंप पंप को स्टोर, मतलब पंप से मिल्क निकाल के कितने कितने ड्यूरेशन में स्टोर करना चाहिए
ओके, सो जब भी आप
मिल्क
पंप
को।
कर रहे हैं और अगर आपको पता है कि अगले 3 या 4 घंटों में आपको ये दूध वापस यूज होने वाला है, तो आप उसको बाहर ही बनाए रखें। अगर आपको वो 6 घंटे के बाद जरूरत पड़ने वाली है, तो जैसे ही आप एक्सप्रेस करें उसको फ्रिज में स्टोर कर लें। और जब भी आप वापस वो दूध, ठंडा वाला दूध जब भी बेबी को पिलाना चाहते हैं, तभी एक पानी, एक में भी एक डेगची या कटोरी या किसी में भी एक पतीले में पानी गर्म करें, और वो गर्म पानी में वो दूध का जो भी कंटेनर है उसको स्लोली हिलाते हुए उसको वार्म कर लें। क्योंकि ठंडा दूध बेबी को हम नहीं देंगे, आपकी बॉडी का टेम्परेचर जो है उसी टेम्परेचर पे बेबी पसंद करेगा दूध पीना। तो वो नॉर्मली 37 डिग्रीज के अराउंड होती है। सो उतना धीरे धीरे वार्म करना है। बेबी के मुंह में दूध देने से पहले अपने हाथ पे चेक जरूर करें कि ज्यादा तो गर्म नहीं हो गया ना। बेबी की जबान नहीं जल जानी चाहिए वो हीटिंग वाले प्रोसेस में, राइट? सो 4 से 5 घंटे तक अगर देना है दूध तो बाहर रख सकते हैं अपने ये वाले मौसम में। अगर समर है तो 3 से 4 घंटे रख सकते हैं, ज्यादा देर ना रखें। बट अगर समझो सुबह एक्सप्रेस किया है, आपको शाम को ही चाहिए, तो एक्सप्रेस करने के बाद तुरंत ही फ्रिज में डाल।
मैम मुझे एक चीज समझ नहीं आती है कि हम जो दूध होता है उसको किस में कंटेनर में स्टोर करें। कभी कभार मैं ओपन करती हूँ ना जब बॉटल, तो उसमें से गंदी सी एक स्मेल आती है
तो
कभी कभार।
एक्चुअली किसी भी प्लास्टिक कंटेनर में स्टोर करेंगे तो उसकी स्मेल तो आएगी। मिल्क स्टोर करने के लिए अलग मिल्क बैग्स भी मिलती हैं, जिसमें आप स्टोर कर सकते हो, या आप किसी भी आपके रेगुलर जो चीज आप अच्छे से साफ कर सको, आप स्टील की कटोरी में भी स्टोर कर सकते हो। जब भी आप
और
फीड करने वाले हो, वैसे भी आप चम्मच से अगर फीड कर रहे हो तो आप कटोरी से भी फीड कर सकते हो, कोई प्रॉब्लम ही नहीं है।
तो मैम कांच के कंटेनर में हम स्टोर कर सकते हैं जो कांच की बॉटल्स होती हैं।
हाँ हाँ, बिल्कुल कर सकते हैं। इट इज बेटर देन स्टोरिंग इन प्लास्टिक और एनी ऑफ दिस सिलिकॉन टाइप ऑफ थिंग्स।
ओके। और मैम हमें कितना पानी पीना चाहिए कि जिससे हमारा ज्यादा मिल्क प्रोड्यूस हो।
मिनिमम 3 लीटर्स।
ओके। एंड मैम जैसे आपने बोला कि सप्लीमेंट आप लोग अवॉइड करते हैं हम लोग, तो मैम अगर हम सप्लीमेंट नहीं लूंगी मैं, तो मेरा मिल्क नहीं बनता है, सिर्फ एक वाली ब्रेस्ट में मिल्क अच्छा सा बन जाता है, और नेक्स्ट वाली जो ब्रेस्ट है उसमें बहुत मतलब ड्रॉप वही वाला बड़ी मुश्किल से 30 ml बनता है बहुत देर तक प्रेस करने के बाद। जो सेकंड एक ब्रेस्ट है उसमें मतलब
तेवढं खाय हे करतोस झोप की आता.
5 मिनट में अच्छा सा मिल्क आ जाता है, मतलब 60 तक आ जाता है 5-10 मिनट
ओके,
के अंदर।
सो कैसे है ना, आप पहले से वो जिस ड्रेस में कम बन रहा है उसमें आप उसको कम ही लैच कर रहे होंगे, ऐसा
वो
हुआ
मैं
है?
वो मैं इसलिए करती हूँ, मुझे उसमें फटाफट हो जाता है।
आपकी बात सही है, राइट? अभी कैसे, मैं पहले ही बोल रही थी कि जहां बेबी ज्यादा सक करेगा वहां ज्यादा दूध बनेगा। तो
हाँ
अगर आप इस ब्रेस्ट पे भी अगर उतना ही लैच करवाएंगे जैसे दूसरे पे करवा रहे हो, धीरे धीरे इसका प्रोडक्शन उसका प्रोडक्शन करीब करीब सेम हो जाएगा।
ओके, तो मैम क्या हमें सप्लीमेंट लेना चाहिए, ये सही चीज
आप
है?
कैसे, अगर आपको जेन्युइनली ऐसा लगता है कि आप कम दूध बना रहे हैं तो हल्का सप्लीमेंट लेने में कोई रिस्क नहीं है, बट नेचुरली सप्लीमेंट लीजिएगा। जैसे कि हम खाने में जो ऐड कर सकते हैं, सौंफ है, जीरा, अजवाइन है, या आप थोड़ा ओट्स यूज कर सकते हैं, थोड़ा बाजरी, लहसुन, मेथी के पत्ते, मेथी के दाने, ये सारी चीजें नेचुरल हैं जो आप आपके फूड में ऐड करके डेफिनेटली मिल्क सप्लाई पे चेंजेस ला सकते हैं।
ठीक है।
ठीक।
थैंक यू मैम। आप तो नोट करके लाए हो क्या सवाल आज बहुत सारे?
मैंने
अब
लिख
मैम,
लिए।
ओके मैम, ठीक है। टाइमर मैं शुरू कर देता हूँ आपका अभी से।
बस ये लास्ट
क्या?
क्वेश्चन है, इसके बाद नहीं है। नहीं सर, सॉर्टेड है, सॉर्टेड है।
ग्रेट। थैंक यू
ओके ओके,
खुशबू।
ठीक
आई
है।
थिंक आपके
थैंक यू।
क्वेश्चंस और भी मदर्स के क्वेश्चंस रहे होंगे, शायद हमने सारों के साथ में
हाँ
आंसर
हाँ
के लिए।
थैंक यू सो मच
हाँ
सर।
हाँ हाँ, यस यस। आज ही एक्चुअली एक स्क्रीनशॉट शेयर हुआ था हमारे ग्रुप पे ना, जहाँ मदर्स से फीडबैक लेते हैं, वहाँ पे ये शेयर हुआ था। एक मदर है, वो ब्रेस्ट फीडिंग करती है, तो अभी उनका आया था कि पंपिंग करने लगी है, और इस टाइप के बैग्स होते हैं जिसमें स्टोर करने को रिकमेंड किया था, अगर ये आपको दिख रहा हो तो। जो आपका सवाल था ना कि कहाँ स्टोर कर
बट
सकते हैं
सर ये भी
वेस्टर्न
तो
को।
प्लास्टिक के बैग्स ही हैं एक तरह से, या सिलिकॉन बैग्स है?
वो
दीज आर
एक्सपर्ट्स थोड़ा बता पाएंगे।
दीज आर जो मैंने बोला ना, मिल्क स्टोरेज बैग्स जो आती हैं।
मिल्क स्टोरेज
You
बैग्स।
get specific milk storage bags जो आप यूज कर सकते हैं। If you look at
हम्म
places where you are asking for breastfeeding
हम्म।
items, वहां आपको मिल जाएगी।
थैंक यू सो मच।
थैंक यू थैंक यू। ओके, सो स्वाति मैम, एक और सवाल का टाइम है आपके पास?
Yes, only one more. I think 6 बज गए
ओके,
हैं।
या आई नो। सो वी आर अनफॉर्चुनेटली, एक लास्ट सवाल हम लोग, बट देन आई एम स्टिल हियर एवरीवन, आई एम स्टिल हियर टू टेक एनी क्वेरीज अबाउट द ट्रेनिंग प्रोग्राम और हाउ इट कैन हेल्प यू, हाउ इट कैन हेल्प यू। सो नेहा मैम, नेहा चोपड़ा मैम, कैन यू प्लीज अनम्यूट योरसेल्फ एंड स्विच ऑन योर कैमरा?
Hi, I'll be quick. So I just
या,
wanted to know my 24th week right now. Is there anything that I should be doing right now to help this process once I deliver my baby? Like any kind of breast massage or anything that you could suggest?
So one thing is eat well, hydrate well. These are two things which you have to take care right now. Normally, we don't do much in terms of doing anything to the breast before delivery, because the more you try to stimulate the breast, there is a chance that your uterus will start contracting. Okay. So even there are mothers who have who start seeing a little milk in the breast somewhere in the 8th month and all, we discourage them from removing any milk from the breast, because oxytocin, as I mentioned, is the hormone which allows the release of milk from the breast, but the same oxytocin also contracts your uterus. So we don't want to do anything which is untoward, specifically in the time where your baby is really growing fast in the womb, right? 24 weeks to the time the baby delivers, 37, 38, 39th week is the time the baby is picking up maximum, right? Baby is growing, its bones are getting longer. There is a lot of mineralization that is happening in the baby's bones. The baby is adding more flesh to its body. All of this is happening now, right? A baby who's probably say 600 to 900 grams now is going to become close to 3 kgs before birth, and it's all happening in these many weeks, right?
Right.
So that's why your nutrition definitely cannot be compromised, but at the same time, nothing in specific to try and do something to the breast as such. Usually it's, your body prepares towards lactation while you're pregnant without really doing much.
Okay.
All you need is a mental preparation that you are going to feed your baby.
Right.
And that's why if you are attending these kind of webinars, learning some more ANC sessions probably will help you to know more about how to manage when the baby is in your arms.
Right. All right. Thank you so much.
All right, Neha, all the
okay,
best.
thank you Neha and ma'am, and best of luck for the journey ahead. And that's from all the mothers who are in this session right now. Okay, so that's the time we had from Swati ma'am. Thank you so much, ma'am. Any last words of advice before you drop?
Yep, very much. I'm so very happy to still see 174 number of participants still on the group, and I'm sure we are all learning together. We'll be very, very happy to help one and all if you are a part of our Baby Nama programs, because any and every problem during breastfeeding, or probably trying to, correct your nutrition during your pregnancy, probably comes to a great help with mothers who are going to be delivering, and for mothers who have already delivered and are able to, settle well during their lactation phase. So it's okay to not feel guilty about what is going on if there is a problem, but at the same time, it should not be feeling ashamed to ask for help. I have seen, very small things where the mother feel inhibited, सामने वाले को क्या लगेगा, मैंने ऐसे पूछा तो बुरा तो नहीं लगेगा ना, will I look like a fool? Don't think such things, asking always solves your problem. So please reach out for help, and I'm sure, you will be happy because you reached out for help. All the best to you.
Thank you, thank you. So, and bye. Yeah.
So bye everybody.
And but I'm still here if there are any queries about the training program. And I've I've just dropped the link in the group chat, and there's this coupon code FEED20. I'd like to take this one query from Prerna ma'am. If you are expecting and having twin babies, congratulations to you. And actually, in this training program, so I remember this query, which it has been asked earlier as well. Sorry, we didn't have time. So I'm just reiterating the answer. There not much difference in terms of what you do. Obviously, you'll have to take in more nutrition because you will be giving double the feed. So that is the advice which in one of these earlier sessions the expert had given, but I'm pretty sure you're in touch with your gynecologist who's monitoring the situation. It's just that when the breastfeeding journey starts, at that point of time, you will have to be taking in more nutrition, making sure that the nutrition is adequate for both the babies. Okay. All right. So let me, yeah, if there are any queries about how the training program works, I'm happy to take them. So you can just unmute yourself and ask the question. So as I mentioned earlier, the training program includes personalized breastfeeding support, private WhatsApp group, and diet and nutrition planning as well in case the nutrition is an issue. And there are a lot of testimonials from mothers who have been part of this journey. There have been even twin mothers. So Rashmi ma'am, I remember she had twin babies. She was struggling with supply, but yeah, that was solved without any supplements. Yes, Sakshi ma'am, do you have any query? Hello. Hello. If Sakshi ma'am you're speaking, I'm unable to hear you clearly. Uh, so I've just dropped the link. Let me drop it once again. So Diksha ma'am, live or recorded classes. See, the reason recorded classes don't work is because it's a personal thing, right? The baby is going through some problem while latching, which cannot work with any generic video, right? If I had to explain you some mathematical concept, it will work. But if I have to train you, first understand what baby is going through, what is the problem that baby is facing, and then give you the right solution. And the right solution also has to be adjusted to your specific body type, right? So some mothers are comfortable with position A, some mothers are comfortable with some other type of position. So the problem is specific, the answer is also specific, and that's why generic videos don't work here. Okay. So that's why, yes, to answer Saloni ma'am, yes, it includes diet consultations with our nutritionist. So it includes diet and nutrition planning. So first we try to understand if diet is even an issue or not, right? We talked about the entire formula trap, and we talked about demand and supply in the session. So I hope you would have attended those parts. So So to answer Deeksha ma'am, if you're expecting, we are actually launching a course for expecting moms. It is more centered around how to increase the probability of natural birth and what to do in the first weeks after childbirth. Because see, there's not much to learn regarding breastfeeding before childbirth because the solution is problem dependent. First, we have to know what the problem is, and baby is not here, so problem is not here right now. Yeah, yes, Deepika ma'am, do you have any query?
Yes, ma'am.
Yeah,
I
please. Take.
Yes, uh,
Sorry, I was unable to hear you.
हेलो
Yeah, Deepika ma'am.
हाँ जी सर, वो मेरा बेटा 4 मंथ का हो चुका है और ये
Okay,
ब्रेस्ट मिल्क बिल्कुल नहीं लेता है इसको। और ब्रेस्ट मिल्क ही पीता है, ये फॉर्मूला मिल्क बिल्कुल नहीं लेता है।
okay, all right.
और सब दिन इसको निकाल के पिलाना पड़ता है, ये वैसे निप्पल से पिलाना पड़ता है, कटोरी चम्मच से भी नहीं पीता है।
Okay. तो आपको गाइडेंस इसमें चाहिए कि फॉर्मूला पेंट कैसे पिलाया जाए बच्चे को?
नहीं, मुझे ब्रेस्ट फीड कैसे कराऊं, मेरे को ये ब्रेस्ट फीड पे लेके
अच्छा,
आना है। ये 4 मंथ का हो चुका
तो
है
वो
लेकिन ये इसकी
हाँ,
ग्रोथ भी ठीक से बहुत कम हो रही है इसकी ग्रोथ।
तो मैम फिर तो मैं यही सजेस्ट करूंगा आप तुरंत से तुरंत एक बार प्रोग्राम ज्वाइन कर लीजिए क्योंकि ग्रोथ भी आप कह रहे हो कम है तो इसके अंदर तो वेट करना सही टाइम नहीं रहेगा इस
सर
बारे में। तो
ब्रेस्ट
इसका
मिल्क
कोई
सप्लाई भी काफी अच्छा है लेकिन ये पीता ही नहीं है।
तो वही ना बच्चे को दिक्कत है मैम, बच्चे को कोई दिक्कत हो रही है, वो बच्चे को क्या दिक्कत हो रही है ये तो बच्चा बोल नहीं सकता ना। द बेबी कांट स्पीक व्हाट द इशू इज। अब वो इशू क्या है वो वीडियो कॉल पे ही एक्सपर्ट समझ पाएंगे,
हाँ जी
राइट?
सर। यस
तो
सर।
वीडियो कॉल पे देखेंगे तो ही समझ पाएंगे कि बच्चे को क्या इशू है। अगर बच्चा बोल पाता तो फिर तो बहुत अच्छा होता, बट दैट इज द
हाँ
इशू
जी
राइट
सर।
नाउ,
हाँ जी
है
सर।
ना? और वो
हाँ
आपने
जी।
तो एक ही बच्चे को देखा है ब्रेस्ट फीड करते हुए, एक्सपर्ट्स ने हजारों बच्चों को देख रखा है ब्रेस्ट फीड करते हुए, तो वो
भी
जब इशू
करता है।
देखते हैं वीडियो कॉल पे वो तुरंत समझ जाते हैं अच्छा ये इशू है, तो इसका ये सोल्यूशन हो सकता है।
तो सर
ठीक है, तो
प्लीज बताओ मुझे अभी क्या कर सकती हूँ मैं।
आप ट्रेनिंग प्रोग्राम ज्वाइन कीजिए मैम और आपका कंसल्टेशन होगा और उसके बाद ही आपको सोल्यूशन
सर
मिल पाएगा। जब तक
ब्रेस्ट
बच्चे को
मिल्क आ सकता है 4 मंथ के बाद भी।
हाँ मैम, अभी जीरो थोड़ी हुआ है आपका ब्रेस्ट मिल्क, आप कह रहे हो ना सप्लाई है तो फिर प्रॉब्लम थोड़ी है ज्यादा।
काफी अच्छा है, मैं 125 ml 5 टाइम्स निकालती हूँ वन
ओके,
डे में।
ठीक है मैम, बहुत लंबा प्रॉब्लम नहीं है, इस पे आप ज्यादा मत सोचिए, मेरा ये कहना रहेगा आपका, क्योंकि
सर
ऐसा वो है कई सारी मदर्स हैं वो फिर सोचती रहती है, फिर 15 दिन बाद प्रॉब्लम बढ़ जाती है।
यस सर।
ठीक है, तो एक कहावत है इंग्लिश में, स्टिचिंग टाइम सेव्स नाइन, तो दैट इज व्हाट आई वुड से कि जल्दी आएंगे आप, जल्दी हेल्प मांगेंगे, जल्दी सॉल्व कर देंगे हम लोग।
ओके सर, थैंक यू।
Sure. Okay. So Saloni ma'am, to answer your query, we have this holistic care plan actually, जो आप कह रहे हैं उसके लिए, where everything is included। यहाँ पे भी है ये Get20 का कूपन कोड है जिससे आप यूज करके ले सकते हैं। इसके अंदर what you're saying, lactation is included, diet for baby mother both included। डाइट बेबी का तो खैर 6 मंथ्स के बाद होगा, एंड पोस्टपार्टम डिप्रेशन इज ऑल्सो इंक्लूडेड। सो होलिस्टिक केयर प्लान आप एक्सप्लोर कर सकते हो इसके लिए, बट वो उन मदर्स के लिए ज्यादा स्पेसिफिक है जहाँ पे होलिस्टिक केयर इज वेयर यू नीड पीडियाट्रिक केयर, यू नीड गायनेकोलॉजिस्ट केयर, यू नीड एवरीथिंग। सो होलिस्टिक केयर में बेसिकली एवरीथिंग इज इंक्लूडेड।
ओके सर।
ऑलराइट, ओके, uh yeah, so this is per month, this is per month, sorry ma'am। इट्स डेली, आई मीन इट्स डेली, मतलब जैसे आपकी आपकी जरूरत नहीं भी हो तो भी हमारे एक्सपर्ट्स एवरी 3 to 4 डेज आपसे पूछते रहते हैं कि कैसा चल रहा है, हाउ इज गोइंग, एंड एवरी मंथ इज अ ग्रोथ ट्रैकिंग कॉल इन होलिस्टिक केयर प्लान। जिसमें the expert gets on a call with you to understand कि yeah, one-on-one basis. Definitely, everything is one-on-one basis. See, every baby problem is mostly one-on-one because group group level पे solutions हो नहीं सकते because every baby is unique, every problem is unique. Uh, so that's why, and not just baby, मतलब most health concerns are unique. That's why all doctor consultations are one-on-one, right? वरना तो हम लोग डॉक्टर्स नहीं होते दुनिया में, हम सबको एक छोटा सा कोर्स करा देते, राइट? कि ये है कर लो. The reason it exists is because every person has a specific different problem और उसका solution different होता है. So yeah, everything is unique and it's all one on one. Everything is one on one.
Hello.
Yes, Namita ma'am. Yeah.
Hi. This is Rishika. It's her daughter. Um,
Okay.
I'm
All
just
right.
using my mother's phone. I have a
No
2.5
problem.
month old baby.
Okay.
I just wanted to check, is there just one time online consultation which I can take because I
No,
don't have any major problem, but I just need to discuss few things.
we are really sorry, but we don't provide one time anymore because a lot of times mothers feel that they don't have a major problem, but
Mm-hmm.
turns out to be major later on. So we don't have any option of one time consultation. We
So
believe
it
in
has to be a
complete
one.
resolution of you. I mean, you can take a single consultation in this program and then not take any further if the
Okay.
problem is resolved. We'll be more than happy if the problem is, see, I mean, we can't say for sure if the problem is small or not before even
I
starting to
understand.
look at the problem. Right?
Okay, yeah,
So yeah,
that's about. Then I'll think about the program then.
sure. Okay.
Okay.
Right. Uh, so if anybody else has any questions about the training program, I'm happy to address them. You can raise your hand or just unmute yourself. Yes, Aisha ma'am. So you can go down and you can check out the different testimonials from some of the mothers who have been part of this program and who've been kind enough to share their screenshot. And I'm pretty sure you'll find someone's journey very close to mine, very close to yours, that they were suffering from a similar problem that you are suffering from. Yeah. The coupon code feed20 is activated till tonight. It won't be applicable, and it won't be applicable later, and it won't be shared in the groups. I'll be sharing the link to the groups. Sorry, link of the program to the groups, but I won't be sharing the coupon code. So if anybody wants to enroll in the training program, you can remember the code till tonight. Feed20. It's not too complicated, and we are sure that the program will help you. So I'll just reiterate the program once. The program includes unlimited breastfeeding counseling. It includes private WhatsApp chat with the expert, and it includes diet and nutrition planning for the mother. So that's all included in the 1 month plan, unlimited consultations, unlimited WhatsApp support. Uh, yes, Rose ma'am, do you have any question? Okay. And the way it works is once you enroll, the team will connect with you, explain you the plan. The first consultation happens within 24 hours. After that, a group is created between you and the expert. And after that, the progress is monitored regularly. And we won't be prescribing any supplements in this program. And even if you prescribe we, any external medicine in very extreme cases, it will be a brand of your choice, right? But in most cases, there's a lot of myth that breastfeeding issues are caused because of nutritional deficiency. We have come to believe with our experience of thousands of mothers, it's not always such. And yeah, so if at all you want to go over the plan once and discuss it with your partner, and you come up with a query later on, there's a WhatsApp icon in the bottom. You can click on it and then you'll be redirected to my team, who will be happy enough to assist you with any query. So the WhatsApp chat option is given here in the site, so you can get any queries about the training program resolved later on. So if there are no more queries, I'd like to end this session now.
Sorry, sir. Actually, my network is not properly working. Sir, I
All right.
asked you the question on like I'm pregnant now, so I'm facing a lot of issue in my breast. So
Okay.
it's like,
For
how can
expecting
I
mothers,
resolve that
I think the
problem?
best way would be to consult
Like
with a
it's feeling
gynecologist
so
offline.
heavy, I can't wear anything. Like,
I think, ma'am, in your case, it would be best if you consult a gynecologist offline, because lactation experts can't
yeah,
get
yeah. I
involved.
consulted, but I was not so comfortable with their solutions.
So maybe you can consult with Baby Nama gynecologist. So just like I showed, you can go on the link, and we have a gynecologist. So you
Okay,
can
okay.
have a
Yeah,
paid
actually, I
consultation.
consulted a doctor nearby me. So,
So I mean, different doctors might have different opinions. Some doctors are more experienced
okay,
than
okay.
others. So that part,
Okay, sir.
I
Thank you
guess
so
all of
much.
us can agree. So you can have a paid consultation with our gynecologist.
Yes, yes.
Okay.
Okay.
Okay. All right. Uh, okay. So if there are no more queries, I'll end this webinar now, and I'll just leave with one final word